speaker has told extensively about the when to start the ARNI and what are the stages of heart failure the ARNI can be used. With every other trials like that of paradigm HF trial, which shows the its improvement. There will be improvement in heart failure patients when there is outpatient. And regarding the paraglide HF trial, following stabilization of a patient in a decompensated heart failure with preserved ejection fraction patients, after stabilization, how it is useful to have ARNI. And likewise, the potential benefit. What is the potential benefit when there is a initiated closer to the time of hospitalization event is manifested by the Paragon HF trial. And what is the new? Next slide. Next slide. What is new other than used in the heart failure? No. Previous slide. Other than used in the heart failure, it can be used in the hypertension also. A first-in-class angiotensin receptor, that is a neprilysin inhibitor. Potential uses in hypertension, heart failure, and what are all the other conditions in which it can be useful, we are going to see. Next slide. So, in a patient with the hypertension, they can go for the hypertensive heart disease to preserved heart failure with preserved ejection fraction or heart failure with reduced ejection fraction. What are all the cases in which the preserved ejection fraction will result, and what are all the cases in which the reduced ejection fraction will result? We can see in the flow chart. The uncontrolled hypertension, it will lead on to concentric hypertrophy, which lead on to diastolic heart failure. That is a heart failure with preserved ejection fraction. When there is a myocardial insult due to the ischemia or a genetic cause or a toxin exposure, these are all the various causes by which the myocardium is damaged. It lead on to the eccentric hypertrophy, and there is a heart failure with reduced ejection fraction. That is a systolic heart failure will result. There are high prevalence of hypertension. We all know the high prevalence of hypertension establishes it as a single greatest risk factor for heart failure from a population health standpoint. Many patients remain undiagnosed, undertreated, or untreated and fail to achieve the control targets. To prevent the seemingly inevitable transition from chronic hypertension to heart failure, the BP should be managed in accordance with the current clinical practice guidelines. What are all the guidelines? Next slide.